Hi, I'm Soumya Bhamidipati, a journalist here at Health Central. We're here at tonight's Chalk Talk on the End of Life Choice Bill. With me is palliative specialist from Canada, Dr Leonie Herx. Leonie, thank you so much for being here.
Yes, thank you for having me.
No problem. So, Leonie, why is this issue important, and what do we need to consider when we talk about this issue?
Yeah, so in Canada, as you've probably heard tonight, we had legislation imposed on us by the Supreme Court. So we didn't get to have a say if this was something we wanted as a country, this is something we wanted as a medical profession. And in New Zealand, you have an opportunity to influence whether the legislation goes through to permit euthanasia and assisted suicide in your country. And in Canada, the story has unfolded somewhat differently than we all expected in the terms of over the 2.5 years since the legalization of euthanasia in Canada. We've had expanded eligibility criteria and plans to further expand the eligibility criteria. So where we started from, where we thought we had this nice, tidy box, as David Seymour is proposing here, we've come to a very different place and are considering things that we never even thought were possible in our Canadian society. So, for example, we thought that it was, confined to people who had a reasonably foreseeable death. That's what the Supreme Court said and the legislation said. And now our Superior Court justices have said, actually, prognosis is not relevant to the discussion here, and patients who have chronic disease and disability and even mental health will thereby be eligible for euthanasia in Canada, which is a very different place than where we started. And the government task force had been mandated to look at further expansion of eligibility for people with primary mental health diagnoses, for advanced directives, and for mature minors who are children who are felt to be capable of making their own healthcare decisions, such as 14 and 15-year-old children. And so this is a place that we're coming to in Canada. We're now talking about death by organ donation in Canada. That's at a recent critical care conference in Whistler, BC in February, where physicians were discussing euthanasia by removal of organs instead of the typical way euthanasia is done, which is through lethal injection, in order to make the organs more viable for transplantation. We're now talking about a duty to inform, that a patient who's diagnosed with serious illness will be informed at the time of their treatment options are being explored, they have a right to euthanasia. This is a very different place that we've come to in 2.5 years than where we started from. And it's really changing the landscape of being a physician practicing in Canada. And so I think there's really no way from a legislative perspective to put a tight fence around this, as David Seymour is proposing, that once you open the gates to allow euthanasia, in Canada it's become a therapeutic medical service and it's become a human right, then anyone is going to be able to get access to it over time. And we're seeing the lived experiences is that criteria does shift over time, as it has shifted in Belgium and the Netherlands, where euthanasia is also legalized. So I think that it's a really important opportunity for New Zealanders to become informed about what happens when this is legalized and how it does change over time and how you end up in a very different place than where you started from. And is that the type of society is that what the New Zealand society wants? So you have an opportunity to do things differently than Canada. It was imposed on us. Does it need to be part of medicine? These are all the types of questions that should be asked. Should it even be legalized at all? So I just hope that New Zealanders will become informed and make sure they speak to their MPs and have their voices heard so that New Zealand can choose a different path than we've chosen in Canada, because we have not gotten it right in Canada. And even though this very rosy picture is painted, there are institutions that are being forced to provide euthanasia that don't want to participate, and there are physicians who are being forced to provide euthanasia by forced referral from some of our regulatory bodies. There are lots of difficulties that we're struggling with, as well as this logical progression of where you go to as a society once you let the genie out of the bottle. So I just encourage New Zealanders to become informed and have their voices heard on this matter.
What have the implications for patients and the general public been as a result of this legislation being introduced into Canada?
Yeah, so one of the things as a physician that I worry about is how we're protecting the vulnerable. And the current system for safeguards and monitoring in Canada is inadequate to truly prevent wrongful death. We do not have adequate oversight of the system. We have some monitoring requirements that are looked at retrospectively after a person has already been killed. And so we really need to be concerned about what makes people vulnerable and how we protect them from wrongful death it's very well understood that people who are marginalized, socially isolated, lower socioeconomic status, people that don't have access to good care, people who feel that they're being a burden to others, those are people who talk about desire for hastened death. It doesn't mean that they want to be killed. And so I think we need to make sure that the 98.5% of Canadians, like in Canada, it's 98.5% who are dying that don't want to die through euthanasia, and 1.5% of people who die that request euthanasia. You need to make sure that the legislation that you pass in New Zealand protects the 100% and the 98.5% in particular who don't want to die through euthanasia, and make sure that there's not even one wrongful death.
Great, thank you so much, Leonie.
Thank you.